Welcome to everyone for this month's CHIA webinar, Lessons of the Second National Job Task Analysis Study of the Healthcare Interpreter Profession. We have with us today Natalya Mytareva, who is a core CHI Russian English interpreter. She holds a bachelor's and master's degree from, remind me, the V in VSU, Natalya.
Volgograd.
There we go, Volgograd State University, thank you. And she is currently the Managing Director of the Certification Commission for Healthcare Interpreters and one of the founding commissioners. She has a background in working with refugee resettlement as well as having authored courses for healthcare and court interpreters and specifically focusing on languages of lesser diffusion. So from a personal perspective, I can say that Natalya is one of the tireless leaders in our healthcare interpreting profession, very dedicated to making sure that patients have qualified, certified interpreters, and that interpreters themselves have the opportunities for training. So I'm very much looking forward to hearing what we found out from this job task analysis. I'm going to pass the controls over to you, Natalya.
Thank you, Michelle. Good morning, everyone. It's a pleasure to be back at CHIA virtually. Usually, I'm very happy that I can attend your conference in person. And this is the second webinar this year that I am actually doing for CHIA virtually. So really happy to be here. This presentation has been delivered by me and our chair, Margarita Becker, your California native, this past conference. So this is a repeat, but I did update the presentation. So there is something different today that you will hear compared to what attendees at the conference heard in March. I want to first start with a brief overview as to what we're going to talk about. So first, I'll give you the reasons why did we have to have job task analysis study at a national level. Then we'll describe what it really is and what it means for our profession. And then I'll focus on the results. That's the bulk of the presentation. What did we learn from the survey about us, healthcare interpreters in the United States? And also, what did we learn about profession and the tasks we perform on the job and our understanding of our job? And then in conclusion, we'll talk about what shall we do now that we have these results? What are the next steps? But before I start, I would really like you to answer this first question that Michelle will share with you as a poll. And the question is, did you actually participate in the job task analysis last year?
So we've got that poll up and we have most everybody having voted so far. I'll just wait to see if there's a few more people that want to join us in that vote. Simple yes or no. No right or wrong answers. Just tell
Absolutely.
us to participate in that survey. All right. It looks like everybody here has voted, so I'm going to go ahead and close that out and share the results. So we see that almost half, a little over half, did not participate, but nearly 50% did. So we had 43% participated and 57 did not. But almost an even split.
Well, thank you, Michelle. This is very good to know. It's just for me to know how much detail I should provide about the actual survey and how it was conducted. But I'm very glad that there are newcomers here for whom this subject is an absolutely new. So why did we have to have this national study for the second time? First of all, any profession, as any occupation or any job position, must have clearly defined competencies and tasks that we do on the job that distinguish this particular profession from any other. And the way to actually create a list of these competencies and of the tasks is to survey all practicing professionals in the field and ask what is it that they do on the job every day. And based on that, then you create the actual valid job description, because it's not something that you thought up, it actually reflects the reality. Another reason why it is important to have surveys is for our certification programs, because certification exams are meant to distinguish individuals who are not ready to do the job from those individuals who are ready to do the job of the healthcare interpreter. And these exams need to reflect the reality, and for that reason we need to first gather the data from the field about what it is that we're doing on the job daily, and then create exam questions based on that reality. So that's the other reason why we had to have the job task analysis. And last but not least is any profession must have some statistical records. As you know, and as I know many of you are frustrated as I am, when I see some statistical data from the Department of Labor, which says like the highest, fastest growing field of occupation in the United States is healthcare. We could be very pleased because we're part of that field, right, as allied professionals in that field. But healthcare is big. It's nurses, doctors, different technicians, different allied professions. We don't know what segment of that growth of healthcare in the United States interpreters occupy. Another data we often get of, and I know we publish it on our Facebook, CHIA published on your Facebook accounts, is the growth in the language industry, right? And usually the way it is presented is like in the next 25 years, the Department of Labor predicts that the translation and interpreting sector will grow by the fastest growing industry in the United States, which is true. However, that mix of translators and interpreters doesn't really help us healthcare interpreters to figure out will our jobs grow, or is it this information, is it only relevant for translators who localize websites, because every business needs to have a website and majority of them want to be present not only in English speaking world but in other countries, right? So but in order for us as a profession to be recognized by Department of Labor and by other statistical entities who do different surveys related to workforce, we need to show them that we exist. And publications like that of the national surveys that are psychometrically valid, they provide that record. They provide something that we can then approach the Department of Labor and say, hey, you keep bundling us with translators, you keep talking about healthcare segments and separate sometimes doctors or nurses, but you don't single out interpreters. But we want you to know that we do exist and we have our own data about this. So that was, another reason why it is important for the national survey to take place and for all of you to participate in it. Speaking of data and statistical data, preparing for this year's annual meeting of the National Council in June, I wanted to take a look at how many interpreters are in the United States, right? You all had that question and you all know there is no answer, right? Because the only right now, there is only one source of counting interpreters in the United States. That's certified interpreters. And that source is split into three areas right now. One is Registry of Interpreters for the Deaf. They count their certified interpreters, and that is a source which is based just on one language, right? American Sign Language. And so we know the latest data they have is for their fiscal year 2016. So as of June 30th, 2016, they had 10,301 certified interpreters sign language, right? The other segment of interpreting field that keeps track of certified interpreters is court interpreters. And there is the situation is a little bit more complicated because the federal certified interpreters, the federal exam that is administered only in Spanish, as of last June, they counted 953 certified interpreters in the United States? Yeah, so if you talk about nationally certified court interpreters, around 1,000 of them, and that has been the consistent number across the last decade and even or so. Then the court interpreting field also has state certification exams, and each state chooses how they publish their data and if they even publish it. Some states that which participate in that exam in the consortium don't publish the numbers regularly. So what I had to do, I had to look at different states, extrapolate, and make sure that I arrive at a somewhat empirically valid number. So please don't feel that this 4,453 is the actual exact number. The 53 comes from the federal number, but I guesstimated based on the available resources right now by the National Consortium of State Courts that around 4,500 certified court interpreters exist in the United States. And then the third segment of information is actually very accurate. The healthcare interpreters, where the leaders in this aspect is, we actually track our numbers of certified interpreters very well. And I'm very pleased to tell you that as of yesterday, because that number could be accessed for both CCHI and NBCMI instantaneously on the web every day, we had over 500 certified interpreters in the United States. Out of those, I'm happy to say that 3,100 were by CCHI and a little over 1,900 by NBCMI. So as you can see, just answering the question, how many interpreters in the United States that work in healthcare, or how many interpreters a period, is very hard. So having these statistical studies is very helpful for our profession to keep maintaining records that go beyond just certified interpreters, because we really don't have a register of how many staff interpreters work in hospitals or how many interpreters work in each language company or other agencies that provide language services. So this is the only record, and then the supplement of it is the job task analysis report. So if we ask ourselves a question, do we exist? If we don't have real data to prove that we exist, or have minimal data, do we exist as a profession? What does it take to make a certain group of people a profession? Well, I'm happy to say that we do exist, right? First of all, any profession has to have a code of ethics, and healthcare interpreters, court interpreters have health code of ethics. So that's the one element that we have, and standards of practice. Secondly, we need to have a specialized body of knowledge, and we as a profession do have a different than court, different than interpreters in education or social services or conference interpreters. So what we have is we all need to know non-English language. That's common to other interpreters and translators, but that's separate, let's say, from the healthcare allied professions of other kinds. We need to have the knowledge of the health systems and cultures of the United States and the patient if we want to accurately interpret between the two parties. We also need to know safety and confidentiality requirements for that for the healthcare settings in the United States. So these elements constitute the special body of knowledge that belongs to us and separates us, let's say, from court interpreters or interpreters in schools or conference interpreters. Now, we also have a special set of skills. They're interpreting skills, yet they are adjusted for healthcare settings. And just to give again a clear comparison to court interpreters, we all know that when you interpret in court, be it for a hearing or sometimes attorney-client meetings, but it's mostly for court interpreting and hearings, you could interpret consecutively for long periods of time, right? Some for trials, it could last for days. You can interpret simultaneously for a long period of time. And when you do simultaneous for more than 2 hours, usually courts use a team of interpreters who alternate every 20 minutes or 30 minutes or so. In healthcare interpreting, we don't interpret for 20 minutes simultaneously, right? Our simultaneous is limited to 5 minutes maximum. And the same thing with consecutive. We don't have a string of questions and answers uninterrupted by pauses, etc., because the whole appointment may last only sometimes 15 minutes, right? So again, we apply the same skills that court interpreters use, or conference interpreters use, but they are different, and so our attention span is different, and the language we deal with is different, right? With court, you have a variety of conference interpreters, you have a variety of registers. With medical interpreters, you really mainly deal with the common everyday language of the patient, and the provider tries to speak at the same level of education. So, but we do have specialized skills that separate us from within the interpreting field and from any other profession. Then we have certification standards, which are unique and different than certification standards for nurses, for court interpreters, right? And we have some elements that we're working on. One of these elements is educational path towards becoming a healthcare interpreter. We have the beginnings of it. You can become an interpreter if you do some apprenticeship, in other words, like training on the job, through some private for-profit training programs, or some college. However, what we're lacking is the curricula that are shared by different colleges. We're lacking the language specific programs. As you know, if like I'm a Russian interpreter, if I want to, let's say I learned Russian at a university, got my bachelor's in Russian, and now I want to become a medical Russian interpreter, I cannot get a college program which teaches Russian medical interpreting. There are several of Spanish, quite a few actually right now, but none in Russian specific. I could get a language neutral program in healthcare interpreting, but it won't help me to pass the exam really. So we need to start working on bringing the level of education available to bilingual individuals to become healthcare interpreters to the college level. That's a multi-year, multi-decade program, but we're on the path to it. We also start seeing the emerging career ladder. In other words, like for any profession, you get hired at one pay scale, you get certified, you get additional education, you get more, you get a different position name like a lead interpreter or a senior interpreter, and with that comes a different pay scale. And then you have different paths to go out of the profession to become a manager or to become a trainer, etc., similar to what other professions have. Again, we're seeing this on the national level. I cannot guarantee that every one of you will get an additional pay raise if you get certified, but more and more employers are recognizing this as a valid requirement within the workforce. And then the last piece of making us a profession is having a disciplinary board which oversees how we actually comply with the ethics and standards of practice. As you know, for nurses, doctors, attorneys, social workers, they could be disqualified and barred from practicing their profession. And our profession, so far, we have a beginning of that concept within the certification bodies. Like CCHI has disciplinary policy, which requires that the certified interpreter follows certification policies by CCHI, but also national codes of ethics and standards. And if we get complaints about somebody violating the national code of ethics, we will investigate and we can apply sanctions up to revoking certification, right? And publicly announcing that. So there are different lists. So far, we haven't seen that, but we're new as a profession and we're moving towards that direction. So what I want you to take away from this presentation, if nothing else, after I talk, is the fact that we exist as a healthcare professional and we are established. So we are not a part of the broader spectrum of community interpreters as it was the case 17 years ago when I just started working in the United States. Because other interpreters in that field, in schools, in social work, and other areas, they don't have these elements that we have. So, for us to exist, an important step was creating certification programs. We have that now, and the difference between any exam and certification exam is the fact that it is what is called high stake examination. In other words, it determines the employment abilities, it affects the workforce. And that's what makes it different than an exam when you take to, graduate from school or to get a degree and graduate from the university. The important factor for maintaining that status of a high stake examination is to have the job task analysis conducted regularly. In other words, to make sure that your examination is based on reality. And for that reason, last year, it was the second time that CCHI had this national survey done in order to create a thorough, accurate, and unbiased definition of our profession as it exists today, to reconfirm what it means to be a healthcare interpreter. A thorough means that we needed to make sure that we are not just listening or listing the opinions of certified interpreters or leaders or experts in the field, but we have the survey available to everyone. That's why it's important for everyone when the next survey comes out to participate in it, so we can get the data from the actual practitioners in the field. In different healthcare settings and in different modalities, because we're not just face-to-face interpreters anymore. We're also video remote interpreters and telephonic interpreters, and sometimes we're all the three, right? Wearing different hats. It is important that the national survey of that kind gives us a representation of the data for that particular time period, because when we compare the survey that we did in 2010, when we were just creating our exam, in 2016, we see the differences. And that's good, because we, as any other profession, are developing, changing, and we need to make sure we catch these changes, and we reflect them then in both the examination content and in the training to prepare new workforce of the future for our field. Also, the data needs to be unbiased, and that can only be achieved if we collect it from everybody and not just from leaders, trainers, or certified interpreters. And we're happy with the results that in our survey last year we did have a fair amount of representation from non-certified interpreters. So what was the process of job task analysis? Since about half of you didn't participate, I just will briefly describe it. Well, we started with engaging with the experts who do job tasks analysis. So there are the measurement specialists called psychometricians who have the knowledge of how to create tests, how to assess different information, and who also have statistical background. So we contracted with the company to do that job task analysis. That was Castle Worldwide. They did job task analysis for pharmacists, for architects, for nurses, for dietitians. So not just for interpreters, but they did this job task analysis for us because we wanted to have a job task analysis study done that is similar to any other profession, so that we're equal among other professions, not just thinking from within the interpreting field. Then we recruited a panel of subject matter experts to create the draft of the survey, the actual questions or the structure of it, based on the recommendation from psychometricians. And we conducted the survey, analyzed the results, published the report at the end of last year. And now what we're doing internally is we are working on updating the content of our exams. And at the end of this year, the exams content for the written exam will be new, different than what you have taken if you're certified or what people are taking right now. And then next year, the oral exam content will be updated. So who were the panelists who drafted the survey? Well, again, the selection process for these 15 individuals was to make sure we represent a slice of the profession. And what we looked at when we selected these volunteers was place of interpreting in terms of, hospital or clinic or insurance plan, modality, face-to-face, video or phone, frequency, because for different languages we definitely are very happy to see that there are full-time interpreters who do it every day, but then there are some languages which are only interpreting once a month, so we had different made sure that we have representatives from interpreters who work in healthcare settings at different frequencies. Years of experience, we had, I think the least year we had about 2 years of experience, and then had 10 plus years additional experience like court interpreters or translators or trainers, managers, so that we can have a broader understanding of the field and not just look at it from within the interpreting view. Type of employment: staff, freelancers, full-time, hourly, that kind of stuff. Languages, how they were acquired: native speakers, heritage, non-native speakers, educational background, actual languages, and geography. We wanted to make sure that we have a fair representation of different states during this process. So that's how everything is done when you develop the certification exam, but it was important that the national survey is written by somebody who is working as an interpreter, but also has different aspects of it in their experience. And this survey in 2016 was different than the first one. When we did the first one in 2010, there were no data about what it means to be a healthcare interpreter except personal opinions or group's opinions, right? CHIA had several publications, Massachusetts Association had theirs, so the ATA had their definition of what an interpreter is, but there was really no what is called independent or unbiased definition. So we had started from scratch. In our first survey had questions: do interpreters carry pages, right? So they were formed as a question. This time, since we already had that definition and done in 2010, and we had exams in existence for 6 years, we just wanted to reconfirm and fine-tune the definition of the healthcare interpreter and actually the job tasks that we do on a daily basis. So the starting point for answering our survey was, the premise is, when you come to on your first day to your job, you already are ready to be an interpreter. And in our opinion, a person who is ready to be an interpreter means it's a certified interpreter. Yes, we understand it's not a requirement, but at the same time, if we don't think that way, we will never get to it as a requirement. Like, social workers in the 70s, when they were emerging as a profession, they also didn't have a requirement to be all licensed and have bachelor's degrees, etc. But they got to the stage they are now by acting that only qualified individuals are hired to the job. Same thing with this survey. So the premise is, when you show up for the first day, you know how to interpret in 2 languages at least, and you know how to do it completely, accurately within the cultural context, right? So the definition was updated a little bit, and I'll show you that in a second. And we also defined the job domains. In other words, like, what areas should a bilingual person master before they become an interpreter? The difference in this survey, second survey, compared to the first one, was the fact that instead of questions, we actually had a statement, because we already knew what the interpreter should do, right? Interpreters interpret consecutively, right? The questions were asked to, the statements were given like that, and then respondents had to rate them based on 3 scales. And I'll talk about that in a minute when I go to the results of this survey. But before, I move on, Michelle, if you can ask the audience, have they read any job task analysis reports published on our website? I know they're buried in the website. It's hard to find, but just curious to see if anyone read those 2 PDFs for 2010 and 2016.
You got it. That poll is up right now, and we've got people voting. So let's see where we go from here. So far, it's looking like the no's are outweighing the yeses. Couple more.
That's something I would expect, because you know, first of all, we are interpreters, right? That means we really don't have the time. So, but also, usually it's trainers or managers or yes, and I can see the results that the majority have not read them. Well, they are available online. They have been available as soon as we publish them, and I'll point you to the links at the end of the presentation. So if you are interested, or if you want to share them with your managers, especially to show that, you know, what it means to be an interpreter, this is the best way, you know, especially the latest one, of course. This way they will actually know that, you know, it's not you telling them about interpreting. This is a national publication that is statistically valid, that describes what it is that we're supposed to do. Also, there's this extreme relevance of these reports for educators and trainers. So if any of you are trainers, you really need to read these reports, because they provide you statistical data about the target audience, who your students are, how you design your trainings needs to be done based on who your attendees will be. It describes also the job tasks and the knowledge, skills, and abilities, KSAs as abbreviation, that are needed to perform the job of the interpreter. So when you create some exercise, you need to really know, is it valid? Will it teach the person to be an interpreter or not? It also outlines our content of the certification exams. And all in all, most professions develop their curricula based on job task analysis. And I'm talking not just, you know, nurses, doctors, etc., but anybody, aviators, I mean, pilots, right? Architects, they look at the jobs task analysis, and then they create their curriculum. So what is this definition of who we are? So the definition that was confirmed by the job task analysis is the following. It is a person who is able to perform the functions of a healthcare interpreter competently, independently, and unsupervised in any setting and in any modality where healthcare is provided, with the knowledge, skill, and ability required to relay messages accurately from a source language to a target language in a culturally competent manner and in accordance with established ethical standards. And when you really think about what it means, is that a person who says that they're an interpreter, a healthcare interpreter, is the person who can interpret in any healthcare setting, right? So OBGYN, genetic counseling, palliative care, any kind of surgery, right? That's the expectation. It's the person who can one day go and interpret in person, next day pop up and interpret over the phone, then do it via video, right? And they're supposed to do it competently, meaning that they don't make mistakes. They know every term. You know, the more you think about it, the more you understand that an interpreter on the first day of their job is a very serious professional. Compare it to a heart surgeon on their first heart surgery as they're hired by a hospital. This is the person who needs to open your, you know, chest, fix your heart, sew it up, and you should hopefully the patient is alive after that. That's the same to the interpreter. So you're able to, you have to do all these things. So a beginner interpreter, an entry-level interpreter, that's what that professional is. Everything else is experience, specialization, preference, what you like to do more, which way you're employed. But you're not, if you are not able to interpret accurately and completely and understanding the cultural concepts on day one, then you're just a bilingual. You're not an interpreter. And that is important to keep in mind when you talk about yourself to other people, that we are a very complex profession. And an entry-level interpreter is as complex as a cardiology surgeon. Our job structure is the same as any other job structure. We all start with knowing something, right? And it starts with knowing the language and knowing some medical terminology and knowing about healthcare. Then we add to that knowledge, because we can read it, we can memorize it, skills and abilities. Because one thing is for me to know English and Russian. It's another thing to be able to actually interpret from English into Russian and from Russian into English, right? Those are two different directions, two different skills, two different competencies. Then there are certain tasks that we're supposed to perform, because we're not just doing that, but we're watching our team members, other healthcare professionals. We're assessing the comprehension of the patient, of what we're interpreting. We're intervening as now. So, and then these tasks, we can group them in certain domains. So that's the job structure. And the same job structure is reflected in the certification exams. So the new domains for the exams of CCHI are based on these new job domains that were defined in the job task analysis. So they're slightly differently named and grouped, but they pretty much are very similar to what we found in 2010, but we had a better chance to fine-tune the grouping of them. So the first domain is professional responsibility and interpreter ethics. That is mostly knowledge about these things, and it's tested at our core CHI exam. Manage the interpreting encounter, in other words, how to intervene, how to introduce yourself, how to do all these things that, ask for pauses, ask for clarification, admit your limitations. All that is part of that domain on the job and on our exam in the, again, multiple choice format, the core CHI exam. Knowledge of healthcare terminology, that is tested on both exams. We have it as English terminology in the written exam, and then we have it on the oral exams for Spanish, Arabic, and Mandarin. Knowledge of US healthcare system also is tested on the written exam. Cultural responsiveness on both exams, because it is not just knowledge about culture and how you would apply it, but also the ability to actually interpret cultural concepts accurately, and that's tested on the oral exam. And last but not least is the domain of actual interpreting in healthcare, and that is purely the performance exam, which exists right now only for 3 languages. So the observations that we made during this survey are the following. First of all, we saw that there's lower social engagement for healthcare interpreters during the survey than from court or ASL interpreters, because when we posted our links on, let's say, RID posted them for us, or court interpreters at NAGIT did, or even ATA did, like within the next 2 days, we had a huge response from those organizations. But we were reposting ours, and we didn't see the increase in responses accordingly. So we know that it seems that healthcare interpreters are not as present on Facebook, at least in 2016 they were not, as the other interpreters are. So hopefully that will change, or we should find other means of reaching out to our constituents. The other observation is the lack of familiarity of how online tools work. We all assumed that, pretty much every one of us had the surveys like, which pizza do you like, which, how was your flight, that kind of stuff. But apparently we still, as a majority of the healthcare interpreters are not quite familiar that usually you will get automated emails for every survey saying that if you have participated in it already, disregard, if not, continue. Yet we still got feedback every time we send an email reminder that, oh, don't remind me anymore. Well, this is, some tools work differently. It's not like me sitting here and emailing 10,000 people individually, right? So we should educate interpreters more about different tools used by the industry. As far as the results, the survey was done in May, July 2016. We had about 2,300 responses submitted. We're very happy with that. At the same time, at that time, there were more than 2,300 certified interpreters in the United States in healthcare. So that means that, and of this 2,300, not everyone was certified. So that means that certified interpreters gave up their voice that would have affected the exam content. Granted that they don't need to take the exam again, but the exam content also reflects what would be the continuing education requirements. So if you think about it, if you're a certified interpreter and you don't participate in a national survey, that means that uncertified interpreters' voices will be heard, and whatever they want may affect your continuing education requirements. That's just simply not cool, right? So I hope the next job task analysis, which will be in 2021-22, we haven't decided yet which year, we'll have more representation of certified interpreters. We had to discard some responses because there were duplicates, and there were some who were just, let's say strictly from managers or from translators. In other words, they're not practicing interpreters. And again, the data we were collecting needed to come from practicing interpreters. Even if you're interpreting in healthcare for 1 hour, you still have a voice. But if you don't interpret at all, then really we kept your opinion, but we didn't use it for the analysis. And we collected about demographic responses from about 1,750 people, but which is more than we did in 2010. So we're happy overall, but we hope through this kind of education now that we're doing with this webinar and keep talking for the next 5 years, we'll see better participation. As far as who we are as a profession, the quick look is state-wise. Of course, there's no surprise. You all know who was state #1, right? California. Thank you, guys. That is definitely, you're the leader when it comes to defining what's going to happen in our profession and in other areas in the country. So that was very good. So the next state, if you try to guess, you won't. I can tell you won't, because the next state was Minnesota, 8%. See the drop, right? 22%. 8%. The next state was Texas, somewhat good. That's logical. Minnesota was not logical. Texas is logical, 7%. Then 6% were shared by Massachusetts and Wisconsin. And then 4% Ohio. I'm in Ohio, so I'm very happy for my state. So what I want to, going back to quickly to the slide, is to explain to you Minnesota and Wisconsin. It's not like they have more healthcare interpreters there than, let's say, in New Mexico, Washington, or Oregon. No, by no means. But what it means is they were advocates for our profession. A couple of them are actually our commissioners, but more than that, who locally were supporting and spreading the word about the national survey. So each one of us could become, right now at this stage in our profession, each one of us could become a leader who will tip the point of something, create a change in something, put your self on the map. So I want you to think of it that in some professions, like, website developers, right, to become somebody right now, it's very hard. Or nursing, right? There's so many nurses, so many website developers. It's very hard to make it as a leader, as an expert in healthcare interpreting. This is the time you could really stand out if you are engaged. And so other statistical data that we got from the job task analysis was, no surprises here. There are more females, 76% compared to males, but again, it's slightly less than in 2010. So hopefully that's good. But it's average for actually across the world, that there are more female interpreters in the world than male interpreters. As far as the age, the majority of us are middle age. I do include people who are from 41 to 16 to middle age, because I'm in that group. But anyway, if you look at it, it makes sense. Why? Because to learn a language, then to become an interpreter, takes time. But at the same time, it is scary, because when we looked at the data, how many new younger people enter our profession, we only had 9% who were between the ages of 18 and 30, and that dropped from 12% in 2010. So we all need to start talking about our profession to kids at school, kids at colleges, so they choose our profession. Otherwise, when we retire, nobody will be interpreting for us. I'm looking forward to my 90 years when I'll probably get either Alzheimer's or dementia, and I'll revert to Russian, and I will need a Russian interpreter in my nursing home, and there will be no Russian interpreters available. That will be sad. So let's start talking up about our profession to our younger generation, so they will start learning now and get enter the workforce later. As far as education, you all know we require 40 hours of training to become certified interpreters, and we all know 40 hours is nothing. So we are happy to hear that, judging by the survey, 58% of the respondents have associate or bachelor's degrees. Not necessarily in interpreting, that doesn't matter, but we are an educated workforce. 23% have master's degrees. Only 13% of our workforce, of those 2,000, right? And again, we're extrapolating, and I know it is skewed, but just for these purposes, we're going to do that. 13% only have high school diploma. So don't think of ourselves as, oh, all you need to have is a high school diploma to be a healthcare interpreter. That's not true. The reality shows that actually the majority of us are very well educated, and 5.5% have PhDs. The sad part is, unfortunately, all that educational background is in something else, because, as I said earlier, what we're lacking is that specific college education in our field, right? The good thing was that 81% had more than 40 hours of healthcare interpreter training, right? So that's, again, proved the fact that even though this is the required minimum for certification, it's not really the reality. But only 6% had healthcare interpreting degrees, associate degrees. I mean, in other words, either certificate from some colleges or community college courses, and then 4% masters or bachelors. And as you can guess, most of them were Spanish. We're stable as profession because if you look at it, majority of us have been in the field for a long time. Over half have been in the field over 6 years. So in other words, when you enter the field, you really get job satisfaction, regardless of everyone saying that we're not paid well, right? Because it's not just the money that makes the job satisfaction. The primary modality of interpreting, 88% is still done in person. 7% is OPI, over the phone, 5% VRI, which has grown from 2% compared to 2010. We saw a slight decrease, but it is not statistically significant to really tell you why we have a decrease in phone interpreting. It could be because of VRI, or it could be also because of education, that some settings just simply scream and require in-person interpreter and not a remote interpreter. We still wear multiple hats. In other words, not many people can afford to be just a healthcare interpreter, although, more and more are that, but we do usually interpret, like 32% at least of respondents interpret in healthcare and in other settings, in other words, court interpreters or schools, and then 24% interpret and translate. In other words, more than half of our workforce do other things in addition to being a healthcare interpreter. Good thing is that 83% of respondents who were managers also interpret. In other words, our managers do not come from outside. They move from within the profession up the ladder. 90% of trainers also interpret. That means, again, our education is connected to the field. We're not taught something that is irrelevant. In other words, all our trainers know what they're talking about. And then we were very happy that we had 121 respondents who are also bilingual healthcare providers and also did some interpreting. As far as the breakdown between freelancers and staff interpreters, 50% are freelancers and 41 are just staff, and there's some that interlap. It is very good to see 41% of being staff interpreters. That means that there is a future and there's a development. So we're not just contractors. We're, have more potential to have earn a living with benefits. However, if you look at the hours that we usually work, still the majority, 52%, work less than 40-hour weeks in healthcare. It's not necessarily bad, but I'm just saying that that's what we saw. As far as languages, 48 languages were selected by respondents. That's good. So it means that we are active across different languages. Of course, 60% are Spanish, but the second one, and that's kind of will tie you in what I said earlier about engagement, was by sign language interpreters. So just one post to RID members produced that big response because their sign language interpreters are interested in healthcare interpreting field and they want to be heard. And that's why I'm so happy when Michelle was talking earlier this webinar about having sign language interpreters as part of the webinars at CHIA. So that is great. And then the next language is Mandarin, and then it drops down to other languages. As far as who are we as for compared to native speakers, non-native speakers, 72% of us do not have English as a native language. So 72%, to translate it bluntly, is 72% of our workforce are immigrants and refugees for whom another language is a native language. So when you are a trainer, you need to think of that you are gearing your training to non-native English speakers. 22% learned a non-English language. In other words, they're native English speakers. Those are the American students who studied Spanish, who studied Russian, etc. And then 6% are heritage speakers. So again, it's a very strong reflection that if our workforce consists of 72% of immigrants and refugees, that means that issues affecting them, affecting patients, need to be taken into account when we are thinking of ourselves as a profession and as our place in the world. We work in multiple settings: hospitals, clinics, physician practices, public health, home health, insurance companies. So when you think of where you want to work, you can choose. And as a trainer, you also need to think that your curriculum should be also addressing different areas. Certification status, remember I said, 2,300 participated and we kept about 2,000 of responses. Out of those 2,000, 63% are certified. The rest non-certified interpreters. So I hope more and more certified interpreters will realize that they're the ones who have the ability to influence their profession. They should use that ability. We also were pleased to see that 8% of the respondents had more than one certification. In other words, they were court certified and CCHI or ATA certified or NBCMI certified. So it was very good to see that we had participation from everybody and not just from our own beneficiaries. So this survey was a moment of reflection for us, and I will just give you one example of what I mean by the reflection. When we looked at the domain of professional responsibility and interpreter ethics, first scale that we used was expectations, and what we asked is, these are the tasks that we need to perform on the job: maintain boundaries, maintain impartiality, assess need for advocacy, address ethical dilemmas, present self professionally, pursue professional growth, adhere to safety measures, and manage stress. And the question was, look at this and see, do you need to do it as an interpreter who are hired to do your job? Not at all. Within the first 6 months of hire or after 6 months of hire. In other words, when you show up for the job, do you need to be able to do these things, right? And that's what was interesting to me. If you look at assessed need for advocacy, almost 18% said, you know what, first 6 months, I don't need to assess need for advocacy for my patients. I'll start doing it after 6 months. That's wrong, right? I mean, I hope you agree with me, because what about the patients that you are interpreting for the first 6 months? What if they needed advocacy and you decided you felt that as a new interpreter, you're not ready for that yet? No, new interpreters should do all of this. Another interesting thing was address ethical dilemmas. Again, 13%, almost 14% thought that you really are able to start addressing ethical dilemmas after you worked for at least 6 months. Again, wrong. You see ethical dilemma, you have on your day one, you have to do it. You have to address it, you have to resolve it in the manner that our code of ethics and standards of a practice to apply. Pursue professional growth. That was really scary, that 38% think that the first 6 months they don't need to pursue professional growth. I think that came, and I know that it most likely these answers came from the fact that people didn't read and think of the implications. Because pursuing personal growth is not meaning that you attend CHIA conference once a year or listen to a webinar once a month, right? It is, if you today at the interpreting assignment didn't know a word, when you come home, you look that word up in a dictionary, online, whatever, right? If you're going tomorrow to interpret to a new setting, let's say dentistry, before you go tomorrow, you study and review your vocabulary for dentistry before you show up for job. That's professional growth, right? It's not just a formal class. It is a continuum of things that we're doing. So I hope that those 38% just simply didn't think deeply about their answer. And then the other, for the same set of questions, we had a different scale, which is called consequences. So what would be a consequence if the interpreter doesn't do this, right? No harm done to anybody, patient or the doctor or the interpreter. Minimal harm is blue, red is moderate harm, and green is substantial or extreme harm. Look at this. Adhere to safety measures. 10% of interpreters think that if they do not adhere to safety measures, there is no harm to anybody. I just hope that, again, they just simply didn't think to, okay, so that means that if you show up sick, actively sick, having a strep throat to an appointment for anybody, that's okay. That's no harm, right? Another example will be if you will go to interpret for a radiology appointment and you just stand by the patient right there where the radiology exam is administered, that's also no harm to anybody. So that is really, when we are interpreting, I know we're focusing and we're doing our job, but we need to focus and answer the questions when we ask them so that we don't get this interesting responses. Another interesting thing about back to advocacy issue, I understand it's one of the hardest thing of our job, but it's nobody relieved us of it, right? We have to learn how to do it. Again, 11% think that there is no harm if an interpreter in healthcare doesn't assess the need for advocacy. That's just simply may mean that as trainers, we have not explained it good enough. Professional growth, again, no harm if you don't know the words, if you don't pursue it. 18% thinks there is no harm to it. So I'm just, again, thinking that through this education and the opportunity that I have right now, I'll show you how important it is to answer questions when you're asked about our profession for any survey, because they can actually show our understanding of ourselves, and they can show how you internalized all the training you did. I have more examples in my PowerPoint, so that's why it's provided as handouts. I'm not going to really, go into detail of every one of them, but what I want to point out very quickly is what was strange is that when we asked the question about US healthcare system, how familiar an interpreter should be with it, again, 36% said that really the first 6 months you don't need to know healthcare system. And healthcare system includes many things, including HIPAA, right? So on day one, you need to know HIPAA. That means you need to know US healthcare system, which to me, that pretty much translates into the fact that, unfortunately, judging by these results, many interpreters, I mean, at least a third, more than a third of interpreters still do not think of themselves as a team with healthcare interpreters. We still need healthcare providers. We still need to bridge that gap between providers and interpreters. If we don't show interest and understanding and knowledge of the healthcare provider world, then we will not be considered an equal team member, an allied professional. We will be considered a person who knows some Spanish who came in to help them understand the patient. And that's not what we are. We are a profession. So with that, I want to open us to questions. if we have some time, Michelle.
We sure do. Absolutely, we have some time. So one of the things, I'm going to wait for people to give people a moment to add some more questions. We do already have some there, but I'll start out just to see how you answer the question about mental health, because when you were talking about working in any setting, I tend to get a lot of questions from providers asking, well, do you do mental health? And to me, that seems obvious that that would fit under the health umbrella, but apparently it's not obvious. So how do you respond to that question, and how do we as a profession help the mental health providers to understand that we also serve them?
That's a very good question, because, as you know, it reflects how mental health is situated and considered within the healthcare itself, right? It is a part of the broader healthcare, but yet mental health is so different than other aspects that they are distinguishing themselves. So it almost seems to the mental health professionals that interpreters should follow the same path. Right now, the way our examination stands and the data that we have been collecting is that mental health is considered part of healthcare interpreting, right? For that reason, when we design questions for terminology or for performance exams, we include mental health settings into those questions and scenarios. We don't necessarily consider it, we consider it as a knowledge of US health system, of medical terminology, of cultural competence. So we'll look at it. So on core CHI exam, which you will have, you may have several scenarios that ask you certain questions, either about ethics or managing the encounter or the terminology or protocol knowledge in mental health settings. And on the oral exams, there are different vignettes of actual dialogues or monologues, and some of them are from mental health settings. It is an interesting question, and I want to share with you that at the annual meeting of NCIHC, I had a language cafe where I asked, where should we go further in our profession, right? And one of the questions I posed to people were, do we want to start working on creating specialization, for example, in mental health? Or should we instead work on creating advanced medical interpreter certification, right? So at this particular event, the majority were leading towards specialization. It doesn't mean we right now have the time or the resources yet to do it, but the interest is there. So what I see is, as we talk more with different focus groups and we start allocating our resources, it would benefit us to create a specialization, but I would think it would be like, you get your regular certification and then you get your specialization as mental health or maybe speech pathology interpreter. Those areas that are so different linguistically and challenging culturally, they may deserve to have a specialization. Did it answer your question?
Absolutely. Yes. Very good. Thank you. So there was just one clarification that was needed, that was requested about NBCMI, which you referred to quite a bit during the presentation. And just to make sure everybody knows that that's the National Board of Certification for Medical Interpreters. Do you want to say a little bit more about that?
Since this is about presentations about the national job task analysis, and since it was open for everybody, when we were looking both at our data, right, we asked if you have any other certification, so there were people who listed that certification, but also when I was trying to get at what is the number of interpreters in the United States, right, I wanted to make sure I consider everybody. So I in no shape or form speak on their behalf, because I work for CCHI and have been with CCHI, but their information is available online. So just again, the caveat, what you saw on that slide was just literally took it off their website, as I did from our website yesterday, in their search engine. So
very good. Thank you. And so there's one question here. how can healthcare interpreters consider themselves as allied health professionals if the pay difference is so considerable?
Well, what we can do is we can start working towards being recognized as allied health professionals, right? Think of it as when medical assistants, right, were emerging as allied health specialty. First, they were a kid who is my neighbor is going to come to work from my office because I know them and I can trust her, right? Then it was, well, I better hire somebody who got something, at least the knowledge of English and how to operate the computer in my office to be a medical assistant, right? So that kind of stuff took time until now there is licensing in some states and certification in other states of medical assistants. And they are recognized as allied professionals because they grew in numbers, they established the certification, they established the training parameters, and they came to HR and say, hey, if you have your funds for development of these employees, you have to have funds for us, etc., etc., right? Their pay scale is definitely different than doctors or nurses. We all know that, right? Or even MRI technicians. They make more than medical assistants, some medical assistants do. But they have went through the steps. That's what we're doing right now. Do I want it to take 1 year? Absolutely. But will it take maybe 10 or 15? Unfortunately, but if we don't show up and if we don't do this work, in other words, become trained, become certified, educate our HR, our managers, our employers or contractors of who we are through showing them reports, etc., then we will never get to the stage of being considered an allied healthcare professional.
Thank you. And I think it's important, that distinction that we're making and helping everyone understand what that means, what allied health professional means. And you gave some great examples there. So we're distinguishing between the health professionals who are doing many times are doing the hands-on care, although certified nursing assistants and medical assistants are doing hands-on care as well. But we're distinguishing from the licensed professions where people have 4 to 6 to 8 years of degrees and often fellowships in healthcare, such as physicians, nurses, social workers, psychologists, etc., and respiratory therapists that have that licensure and significant training, versus, as you said, the medical assistants, certified nursing assistants, technicians, phlebotomists would be an example of that.
Mm-hmm.
So all of these support, when we're talking about allied health professional, we're talking about all of those roles that are still supportive and necessary. And I think you touched on this, but just for everyone who's not as familiar perhaps with the history, do you want to explain how, I think that your point is here is that if we go back, was it maybe 5 or 10 years prior to the National Council updating some of the standards of practice and the codes of ethics, we weren't talking about medical interpreters as part of that healthcare team. We were talking about them as being separate. Now we're trying to make sure everybody understands that healthcare interpreters should be included in that team.
That's right. I fully agree, because when I entered the field in 2000, right, and at that time we were still separating. We were still, what I would say, stewing in our own interpreting juices, right? We were looking at ourselves as interpreters only, just learning medical terminology. And what I've seen over these 17 years is the shift is that really, if we want to be successful and viable as a workforce, then we need probably to ally ourselves, nice word, ally, right, with and align with healthcare, because that is the fastest growth industry. And the nature of the work that we do, the nature of the interpreting role in healthcare setting is such that we have to collaborate. We have to know and share certain responsibilities. Safety of everybody is one of them, right? While court interpreters really don't have to share that. if you think like, because in court you have the marshals, court marshals, you have other officers whose thing is to watch the room and see if anybody is going to shoot anybody, right? In healthcare settings, we all see that if there is some hazard, biohazard or other hazard to health or safety of another person, we all jump in and take care of that. So that made us over these last 17 years to reconsider somewhat and think of ourselves as a member of the care team. And that's what I think is valid and valuable and makes us, a stronger profession than before.
And that also had implications with regard to confidentiality and HIPAA and other types of training. You mentioned the safety training. So many hospitals are doing the credentialing and including interpreters now with safety training. So all of that was part of really now seeing those interpreters as part of the care team rather than a separate entity, as you described with legal interpreting. So great. So there's a question here about certifying organizations helping to ensure higher wages for certified interpreters. So the question, the attendee has asked, how do those organizations help to ensure higher wages? And I guess I would also sort of preempt that a little bit to say, is that the job of a certifying organization?
Yes, thank you for that question, because that was kind of like the beginning of my answers, right? Within our field, we all have different roles to play, right? And of all the people we know, interpreters, I mean, of all the professions, we know about different roles, different hats, right? Part of our training. So it is important to understand that the role and mission of a certifying body is twofold. One is to provide the standard that could be, a measure of competency for anybody entering the field, and to provide the assurance that that standard is met, and otherwise have some disciplinary abilities to revoke certification, that kind of stuff, and to make it accessible to the public. That is it. We also understand that in our profession, which is just emerging, any certifying body will take some other additional roles. In our mission, in our vision right now for the board, for the that was from the beginning of CCHI's existence and still continues now, is this third role we see is education of interpreters about the importance of our profession, education of healthcare providers and administrators about the standards and the role and the fact that we do exist, education of trainers, etc. But we don't feel that we have the capacity to take on any other roles that are not the pertinent role of our existence. So we're not an advocacy organization for interpreters. That's why associations exist, mutual assistance groups exist, and other, voluntary organizations that create that advocacy for the profession. We're not that. Eventually, when the numbers are there, right, when we have 10, 15,000, with those numbers, we may choose to play a bigger role in terms of, lobbying at the, labor department level for the profession, etc. But again, that doesn't necessarily mean affecting a salary of one particular interpreter at one particular place. Through education, though, as you may know, we did just hold a wonderful webinar about civic engagement, trying to educate interpreters how they can engage and start advocating for themselves. And actually, Don Shinsky, one of your folks, was the presenter there and talked about the advocacy at the state level. So we thank Don and thank CHIA for letting Don talk to us. So it is important that we all understand our roles, and we do play the role in it. So unfortunately, again, at this time, it is not the let's say, unfortunately for many interpreters, certification body's job is not to make the job uh, uh, conditions better or the job pay better, but to provide this understanding of what the job is and what the standard is. Then you take the standards to your managers and say, this is the national standard, you're not meeting it, and that kind of stuff.
And having said that, you are, however, the three certifying organizations that you presented are allowing interpreters, as you said, to raise the bar, raise the standard. And by doing so, by having more credentials, always, whether it's education, certification, licensure, understanding of how to interpret in different modalities, any of those things that enhance somebody's education, skills, or experience should necessarily increase their pay rate. And I would think that also, you mentioned the associations. I don't know that everybody realizes that as well, but definitely the professional associations have a role in helping to advocate on a more professional level. And everybody in the profession, I personally see it as everybody in the profession is responsible for being a part of those organizations, for choosing one and being part of that voice, as you've done with the survey, but being a part of that larger voice, because it's only membership that helps us to understand what people's needs are, what interpreters' needs are, and then to be able to advocate on behalf of individuals and the profession. So in CHIA's case, for example, you did mention Don Chinsky, and he's our executive director for CHIA. And CHIA does take a role and tries to address issues when it comes up, when there's legislation. For example, the End of Life Act that was passed recently in California. We had a lot of conversation about that during a past webinar and also during the conference. And we're trying to bring awareness to that on both sides, both with the interpreters and with the legislators, so that they understand what the needs are, and some of the the different ways that things that they try to propose in legislation will actually impact interpreters on a daily basis. They sometimes do that without really having a full concept of what the impact is going to be. So it is our role as the association. So I'm glad you mentioned that. I think our last question here then is, there was a question about the number of certified interpreters for particular languages. Is that data broken out either in your report or somewhere online that interpreters could refer to that?
Absolutely, and let me get to our website so I can show you where you can get it. So if you, from any page on our website, cchicertification.org, if you go search National Certified Healthcare Interpreter Registry, right here, if you go by the state, let's put California, and let's select the status of CHI, which would be the ones which have, Arabic, Mandarin, or Spanish, and I put all languages, and you can see that, click filter, and you can see here is a number 618 certified interpreters in California who have CHI certificate, and then they have the language here listed. You can do this search specifically if you want to say, for example, if there are any interpreters of Albanian who are, let's put their all statuses, and we can see that nobody in California speaks Albanian, but let's see if we have any Albanians, period. I'm just curious myself now. Okay, there are 5 Albanian core CHI, 4 core CHI, and 1 is candidate. In other words, this person is taking the core CHI exam within the next month or so. And so that's how you can do the search by languages. And some people sometimes ask, oh, I can't contact them because they didn't put their email there. Well, that setting is the person's preference. So if the candidate didn't choose to show their email, then we cannot do anything about it. We value the privacy of our certificates, but their names and their certification status is something that we are required to make publicly available. So yeah, there you can do the search. I also wanted to use this opportunity to quickly comment on your last statement, Michelle, because it is very important to be engaged in associations. And CCHI, we cannot advocate for you to have a higher pay directly, right? But indirectly, we can lead, the whole field towards that realization. And one of this is engagement in associations, what we are adopting, and you will have the full announcement pretty soon. I want to say by the end of September, that CCHI as you know, requires certified interpreters every 2 years to have 16 hours of continuing education. Out of these 16 hours, we would allow up to 4 hours to be non-instructional continuing education. And what it means is several things. Your membership in a professional organization, you're volunteering for a professional organization, doing research or publishing uh, books, articles about the profession will be recognized. Your participation in outreach activities, for example, if you go on a mission with, let's say, Doctors Without Borders, that would be recognized. It's not many, up to 4, but it still is important. So let's say we don't have the logistics yet finalized. We just have the number voted on, right? The commission has decided on that. But let's say if you're a member of CHIA, you'll get 0.25 hours just for being a member of CHIA that year. If you are a member of the education committee, you may get a whole hour. If you are a volunteer at CHIA conference, you may get half an hour or whatever of continuing education from CCHI, because we understand that when you get certified and you get involved in the profession, you are returning back to the profession. You are moving us all forward, and we want to thank you for that. So that's wanted to give you this preview of what's coming soon with CCHI.
That's very, very exciting, and I look forward to seeing that formal announcement, and thank you for sharing that, Natalya. And I think just circling back to the previous question about salaries, I mean, just the fact that certified interpreters are listed and have the opportunity to put their emails there, that is an opportunity for jobs. So what I would suggest even there, make sure, have a nice professional email address, and have a it's not uncommon for interpreters that want to get contacted for jobs to have a little personalized website. So, those are things that you can consider as well. So being certified can help agencies or hospitals to find you and to recruit you for work. So with that, we're going to go ahead and wrap up the webinar for today. Thank you so much, Natalya, for all this great information from the survey. And I look forward to the next one to see what we learn and the trends. It will just continue to become, I think, more and more interesting as we see the trends from one survey to the next. So the surveys in themselves are fascinating, and then we get to see over time how things are changing.